I think that if you can prepare a patient for surgery with various agents that are out there now, they have a better outcome and shorter length of stay and fewer infections. You know, we routinely use fish oils as a precursor for SPM, let the body make the SPMs. We have several small studies using SPM concentrate, from fish oil concentrate. I find that in fact, it's very difficult to see specific changes in outcome of an individual, but on a trend we see a decrease in inflammatory responses by measuring CRP and other agents. Well, again, we don't have a lot of clinical data with SPMs. We assume we're getting SPMs produced by the body if we deliver adequate fish oils, substrate, EPA, DHA. So most of the data and the surgical literature is in delivery, except for experimental stuff. Most of the literature in the mainstay surgical patient is with the use of fish oils or immunomodulation nutrition. And there we show decreased length of stay, decreased days on ventilator, decreased infections. I mean, there's a myriad of benefits, and that's pretty well shown by literally hundreds of studies now. That's changed. We now give 4 grams of EPA DHA combination for 30 days prior to surgery to protect lean body tissue loss during the perioperative period, especially post-op when patients are usually immobilized. It used to be 2 to 3 grams a day for a month. To raise steady state levels of EPA DHA takes about a month. So now we're giving 4 grams to give it a little bit more pharmaconutrition. Yeah, I think that we lower inflammatory response. I think that's pretty well proven. We can decrease by whatever marker you want to use. We decrease the free radical oxygen production. So I think we lower the total metabolic stress to the host. By doing that, we protect lean body mass and hopefully maintain a healthy immune system and look for those results. But it's very difficult to say individually. You have to look at large populations and see that benefit, because surgical patients are so heterogeneous. You have to have a big enough study to follow that. We employ, depending on the surgery, probably the maximum would be our pancreatic surgery, esophageal surgeries, major gastric resections and things, and major cancer surgery, really. We give 30 days preoperative, 4 grams a day of fish oil, orally, if they tolerate it. If not, if they're on parenteral, we use an intravenous lipid emulsion. So we 30 days before, then 5 days before, we add an immune modulating formula, which is several companies make now, which contain arginine, fish oil, and some of them contain RNA. And that bumps their daily intake to about 8 grams a day for 5 days prior to surgery. You know, I'm a clinician, not majority of my time is as a clinician, and so I find that, one, the patients really feel this is empowering them to get better. So if you explain to them the benefits of these and show them the scientific data, obviously in a descriptive form, they engage and they really take it to heart and usually will support us with, an exercise, fish oil, high protein diet preoperatively definitely makes a difference. So I think that's where we are aimed at, the prehabilitation programs for patients getting major surgery. That's where most of my work is recently. Yeah, we use it occasionally in our patients. With inflammatory conditions, usually they come to us with inflammatory conditions, rheumatoid arthritis, things like that. We will use occasionally the Metagenics product. We think it's a valuable product, and it's a little bit more of the SPMs. And so we also, this is anecdotal. I don't have any hardcore data, but I do have, we've noticed that our patients who get heart transplants that have elevated CRPs, very difficult to get them back to a state of anabolism. We found that the SPMs really help us there. We've now treated about 15 heart transplants that have elevated CRPs, and we get them back to a state which seems to be better. And a lot of their, we hear that they feel stronger, feel better. But again, that's anecdotal information, not data.